Doctors of Reddit, what was your how the FCK did you survive that moment? An elderly lady had a massive brain hemorrhage, was transferred to terminal care to the health center and patient ward I was working at as the doctor. Her prognosis was that she would die at any moment. There was no treatment. She was comatose, but breathing spontaneously through a tracheotomy tube. A week passed, with no medications, no food, no fluids, still alive. Then she began to stir, came conscious, delirious, but conscious. So we started IV, fluids, appropriate medications, and eventually physiotherapy. After a few months she moved into the local nursing home, lived for a few years. She had profound dementia, but was able to move. I wonder if the air moisturizing device in the room, because of the tracheotomy, kept her hydrated, because a healthy person would generally not survive a week without fluids. Not yet a doctor, but I work as a paramedic in soccer events. Being from Argentina, it can be pretty freaking intense. There was this time when we were at the stadium with my colleagues and 3 guys carry a 4th guy, covered in blood and totally unconscious. His pulse rate was berserk and we got kinda worried. While we start strapping him to the stretcher, I asked the other dudes WTF had happened, and they told me he fainted and fell down the stairs, and as he didn't respond we gave him some C to wake him up. We rushed him to the ambulance and within the first 10 minutes, the guy walks out and asks for a sandwich. Humans work in mysterious ways. Not a doctor. My dad who is one told me this story once. He has this 12-year-old patient, let's call him Tim, and everyone in the hospital firmly believes he's immortal. Tim was born with a bad heart and is constantly in and out of the ICU. By in and out of the ICU, he goes in almost once or twice a month. 9 out of 10 admissions, Tim flatlines. Strangely, Tim always comes back, even if you don't resuscitate him. I'd say Tim flatlined about 15ish times in total. It's at the point that whenever Tim flatlines, nobody panics. Not even his mom, and the first 3 times she fell on the floor crying. Hey guys, Tim's vitals are dropping. Again? Whew. The kid's definitely going for a record. Tim's pretty chill about it too. He talks about his IQ trips like how a normal kid talks about a mildly eventful day at school. Nobody knows how TF does Tim always come back. He just does. Frankly, I'm surprised the media hasn't done a story about it. BC, it's freaking metal. Okay, now I want biannual updates on Tim. Tim reached the big 3-0 today. Tim's had a good year and the IQ has been awfully quiet without his resilient spirit. A patient in his late 90s was admitted to our hospice for terminal care, i.e. to die, because of untreatable multi-level bowel obstruction. Confirmed on CT scan, and clinically obvious from his swollen abdomen and profuse vomiting. The guy was, however, absolutely charming and completely at peace with this. He did want discomfort, and felt he had had a good life. He was scared to eat because of the vomiting it caused. If your bowel is blocked, then any eating has to go back out the way it came in. Otherwise he was comfy enough with just a little pain relief. He was also lovely to chat at, very reflective and articulate in his speech and mannerisms. He had been told he had days, possibly hours, to live by the surgeons at the local hospital, and he barely drank anything, and ate literally nothing. This continued for 2 months, and though he lost a tremendous amount of weight and physical capability, it seemed that during this time his bowel obstruction had spontaneously unobstructed. We ended up getting him home. The sad thing is, however, he had completely come to terms with his death. He is now still petrified of eating, and believes super strongly that his bowel is going to obstruct again, which it may. He just doesn't ever want to go through that experience again, and I do sometimes wonder if he would have been better off dying peacefully with us. Carotid blowout following free flap reconstruction in an oral cancer case. Had a post blowout HB of 30. No idea how she got away with it. Also, when working at a military hospital, the guy whose parachute didn't open, and he ended up with just a fractured cheekbone? Like, what? I am not a doctor, but when I around 23 I was stubborn and didn't go to the doctors for feeling weak and numb all the time with some blackouts. I brushed it off until I literally couldn't get up to walk to the bathroom, thinking it was just a cold or flu. When I finally made it to the my blood count was a 3. Regular is around 14. Doctor said he didn't know how I was alive still. Imagine a doctor walking in all confused and being like, "Son, you don't got no blood." Early years in medical school I saw a surgery of a policeman who was shot in head in a gunfight. The bullet went through his skull and brain. With my experience in games and movies I always assumed a headshot is instant death, but that man survived it and I was in shock how this can happen. Turns out in many cases a headshot can be survived. Sorry for my English is not good. Your English is pretty good. I understood you easily. Emergency physician. I had a patient that was shot 9 times, 3 bullets to the head. He didn't call an ambulance. He brought himself to the emergency department. And by that I mean he drove himself to the emergency department. The 3 bullets in his head somehow didn't enter the cranium, so his brain was just fine. One of them entered his cheek and went underneath the skin to swing all the way around to the back of his head. He was discharged the same day. A doctor asked me this. I was asleep in the back of a pickup on the way back from a rugby tournament one night and we had a head-on with a drunk driver. I went through the back of the cab, through the windscreen, hit and bounced off the other car and ended up maybe 20 meters from the accident. Multiple broken bones, compressed vertebrae, internal and head injuries. After multiple surgeries and a year in hospital I walked out. At the first checkup, the surgeon, who I knew really well by then, said exactly that. Seriously, how the frick did you survive that? My unvoiced response was sometimes I wish I hadn't. I was the lucky one. Paramedic. Dispatch to shortness of breath, and considering that a sob dispatch is typically BS, I wasn't all that ramped up when we came on scene. The FD beat us there, and when we pull into the parking lot, the junior FF is running out to the ambulance to get us and says, "We gotta get him outta here." No biggie. Let's see how the other FFs are acting. At the door, the engine captain is looking stressed and says, fittingly, "We gotta get him outta here." Not good, but he's not a medic. What does the medic think? Brian, the medic, is an absolute rock star whose judgment I trust under any circumstance. Brain says, "No crap, we gotta get him outta here." The patient is a 19-yo, male, pale, cool, and sweaty skin, massive air hunger, and confused. Oxygen saturation is less than 70%. We are 8 minutes from the hospital. If I have learned one thing in the last 12 years, it's this. If your patient tells you they're going to die, believe them. En route, his HR tanked, his pulse is faded, and his breathing slowed dramatically, which, as I am sure you know, is bad. Start CPR? Yes, but when we compress, this kid opens his eyes and pushes us away. Doing CPR on a patient who's watching you do CPR on them is an interesting experience. Eventually, he quit pushing us away, so our job got easier. We worked him all the way to the hospital. The ED worked him for an hour and a half. The epinephrine, fluid, norep, etc. briefly producing pulses before they'd again fade away. There was a period of VFib in there too. Ugh. Eventually, they managed to stabilize him, but it didn't look good for our friend. He began to seize, and it looked like he was going to come out with considerable neurological deficit. As you can probably guess, he lived. It was a big ol' saddle embolus, or, in layman's terms, a huge clot blocking blood flow between his heart and his lungs. Kid had a known coagulopathy that he didn't manage. They told us on scene that he would joke that someday, he'd just drop dead. Well, not this time. Walked out of the hospital a week or so later without any deficit. How? I have no idea. Side note, that was the last call of an 11-year run at that job. Couldn't imagine a better way to leave. Frick yeah. If your patient tells you they're going to die, believe them. Unless that patient is me, because I'm an absolute drama queen. I was screaming, "I feel like I'm gonna die" when I was 8 centimeters dilated while giving birth to my first daughter. Granted, she was kinda stuck, posterior face presentation, and had been in labor for quite a while, but I wasn't on my way out, that's for sure. Obligatory not a doctor, ex-nurse though. This happened to my gran-in-law. She was in her early 80s, on blood thinners, and took a nasty fall and hit her head. Quite a common injury unfortunately, and she was admitted to hospital. The amazing part is that for 3 days her condition worsened and the signs that she had a brain hemorrhage went unnoticed. That is until she became unresponsive. Then we had all the bells and whistles. She was airlifted to a larger hospital and I spent the day preparing my family for the worst. The bleeding had gone unchecked for a long time, and if she did survive, prepare for her to be different. That Wonder Woman woke up a few hours after surgery with zero impairment, memory intact right up to hospital admission. It was an amazing recovery that we're all very grateful for. Obligatory, not a doctor, but was attached to a hospitalist at a pretty big teaching hospital for the summer as like a clinical assistant. This guy comes in for intentional foreign body ingestion. He swallowed a knife, about a 3-inch blade, and it was now lodged in his stomach. The gastroenterology team got photos of it and prepped him and somehow removed it. While he's on 24-hour watch to make sure he doesn't do it again, he manages to get his hands on a pen someone from the GI team left in his room and swallows that too. After it was taken out, we had to basically leave all sharps, pointy things, and swallowables with the security guard before we could go into the room. Not a doctor, so sorry, but I'll contribute. I will never ever forget a guy coming into the emergency ward with a freaking serrated combat knife sticking directly out of the top of his head. He was walking himself in. To this day I cannot comprehend that. I read this one where this chick tripped over while cooking or something, then started experiencing a bad headache. She drove to the emergency room and found out that she had a knife sticking out of her head. Not a doctor. This is a story about my dad's best friend, or as he's more commonly known, the human kebab. So this guy decides to take his dogs out on a walk on a particularly cold Scotland morning, and on his way out slips on some ice. Unfortunately, he landed on a metal pole that was being used to hold up flowers or something. Anyway, this pole goes in through his side just under the ribcage, I believe, and exits through his neck. After being rushed to the hospital and had x-rays and whatever done, the doctors concluded that the pole had missed all vital organs, veins and arteries, and they basically just had to pull it out. This all happened many years before I was born, but it still absolutely blows my mind. Upvote for the human kebab. Glad he's okay. Not a doctor, a family friend. As a teen, my friend's son had all sorts of bladder and kidney infections. The doctors could not figure out what was causing them. Finally, they did a scan of his whole abdomen to try to see what was going on, if there was an obstruction or something else going on. Turns out he inserted a long wire up his wiener. He said it felt good. He lost his grip on the wire when it was almost all the way in and he couldn't figure out how to remove it. He didn't tell a doctor or anyone because he was embarrassed and thought he would get yelled at. He did a lot of damage up there, mostly due to infections. You hear about rectal foreign objects a lot, but good god, that's gnarly. My husband was the patient. His doctor even wrote him a letter congratulating him on his recovery. He was jogging and had a heart attack, collapsing on the side of the road. A couple found him and called an ambulance. He then arrested twice on the way to the hospital and had a balloon pump inserted on arrival, with emergency surgery to replace a heart valve just 12 hours later. To make matters even worse, he then had secondary complications and ended up in the hospital for 3 months with a nasogastric tube. In a really rough city in the US, a young kid comes in as GSW to the head. Head and torso is completely covered with blood, but he is still semi-conscious after pre-arrival for trauma code. Dead. Skin and hair are all macerated. Ace-wrapped skull and sent to CT. No brain injury. Grazed to the scalp. Left AMA. Against medical advice. From the hospital the next day after 4 units of blood. He came back 2 weeks later with brain abscess due to him not taking antibiotics. He lived, needed a long course of IV antibiotics. I had another guy who had a bad dream where he woke up and said some guys were standing over him that said take him out before his dream ended. He kept on repeating himself. I think I was shot in the head when he arrived. I am chomping at the bit to examine him, but the nursing staff have to trauma triage him to be a trauma before I can examine him. I don't understand that to this day, but anyway, long story short, they called him a trauma because he was repeating himself. He had bullets that was sitting off of his petrous ridge that entered via ear canal. No external bleeding. He didn't live though. He lasted 16 hours. Rolled well for the tough con saving throw but failed the simple int check later on. I'm the patient. At 2.5 years old I had a stroke. I was in a coma for about 8 days. None of the doctors could believe it because I guess it's unusual for someone to have a stroke that young. Before I woke up, a doctor even told my parents to prepare for my death as I wouldn't make it. Well, I still had brain activity. Reacted to my parents touching me, talking to me. Not physically, but they could tell by my brain activity. Eventually I opened my eyes and very slowly progressed to moving. I had to relearn how to walk and talk as part of my brain had died. Surprisingly, I really don't have any side effects. I'm really lucky. I had to relearn how to walk and talk and got better at it than you could before. I had a guy who took a 10-inch long metal pipe right between the eyes. When we came in, the pipe was sticking about 4 inches out of his face. He was fully conscious and could move both eyes, a little pale, though. When we got the images, the tip of the pipe was about 3 millimeters from entering his brainstem. Dude made a full recovery. Paramedic here. Dispatched to a person who fell. Another update said unconscious. Last update about a minute or two before we got there was unconscious, not breathing. CPR in progress. Lady in her 40s is dead. Like for real. She's cold, has rigor mortis. Pupils are fixed and dilated. Monitor shows asystole. Not only is she dead, she's been dead for a while. Fire department is doing CPR, but it seems futile at this point. I call the hospital to talk to a doctor. Hey, can we get orders to terminate resuscitation efforts on this patient? I ask the physician on the other end. Nah, she seems kind of young, and I know it's probably futile, but go ahead and keep working and bring her on in, was his reply. That's cool, no problem, we will keep going. We get the IV. I intubate her, give her some epinephrine, put the thumper on her, give some more EP, some bicarb, and holy crap, she has a pulse now. A week later she gets discharged from the hospital to rehab with only mild cognitive impairment. Basically, she had to learn to use a spoon and fork again, and she lost a week or two of her memory. And that's the short story of how I tried to kill a lady but wound up getting an award for it. So this happened in a third world country. Med student. It's Saturday evening, pediatrics shift. The neonatal service sends us a newborn. The reason written is that they don't have enough places. The newborn had very high CRP, an infection marker, so very likely to die if he doesn't get the correct treatments he needs. And this is implicitly the reason why he was sent to us. They prefer to only keep the safe, able patients since there aren't so many places. The problem is that our service was for grown childs, and it's not our specialization at all. Neurology plus endocrinology. We don't have the necessary infrastructure to help that kind of children. We don't even have the necessary drugs for our own speciality, so for the others, XD, we need those heating beds, since it's a newborn. Without them you can give any treatment you want, you will have no results. So after some thinkering we improvised one. We took some serums and we heated them in our oven. Then we surrounded the little boy with them and some random antibiotics. But we knew it was only a provisional solution. The inevitable would come one time or another. A few hours later it's 8 o'clock. The shift is over, we can go home. We were quite sad about the little child. We tell him goodbye. And as you may have already guessed, on Monday he was still more alive than many of the others. Technically speaking, it was impossible to survive this long, and we were genuinely impressed. Those babies are really good fighters. I don't know if it's a good idea to tell this kind of stories on the internet to random strangers, so excuse me if I have hurt any of you guys. During my internship, I was working the free clinic and a man came in, I'll call him D, holding his own small intestine like a baby. As I was the only doc in the clinic, I was pretty freaked out. Anyway, I paged trauma right away, but his organs were outside his body for too long and he became septic and sadly did not make it. I still find it amazing that D was able to walk nearly 6 miles holding his intestine. That's incredible. While being investigated for muffins, they discovered a PDA. I was 12 and had no symptoms except mild tiredness after exercise. I had surgery 2 weeks after the diagnosis. I was also exceptionally anemic at the same time. They had no idea how, as I ate a healthy diet, anemic with a dodgy heart and a family history of hemochromatosis, excess iron. Then a decade later it was discovered I had valvular regurgitation in my heart, then a bundle branch block. This was only discovered because I had pneumonia. Then another murmur was discovered this year because my echo records were missing and my GP wanted to have a listen, so I got them redone. I suspect if I see a GP for a flu shot they'll discover I've had 3 heart attacks or something. Surgical intern year. Guy came in from a hang gliding accident where he fell when a strong gust of wind blew him out of the sky. Luckily, maybe unluckily, he fell into a grove of trees. He presented to the trauma bay with a stick coming out of eye, saying he couldn't see out of that eye but had vision in the other. Initially we were impressed that he survived a 100-foot fall from the sky, but then we got the CT scan. Turned out the stick actually went through his eye, across his skull, and almost to the other side, about 7.5 inches inside his head. He amazingly was still conscious and talking before he underwent a 15-hour-long surgery involving neurosurgery, and ophthalmology. Aside from losing the one eye, he made a full recovery. Not the doctor, but had one once say that I was lucky to have survived, albeit not a really exciting or dramatic story. In gym class back in high school we were playing indoor field hockey. We're supposed to have been using foam or soft plastic equipment for safety. Someone grabbed the regulation grade field hockey ball by mistake. Regular balls are solid plastic, maybe with a cork rubber center. I ended up taking a slap shot to the side of my head behind my eye but in front of my temple at maybe a meter away tops from a kid that played ice hockey at just under national level. My glasses exploded into many pieces. Leg fell off, frames snapped at different spots, lens shattered, and a mild concussion. Not really sure how, just going by the note I had to turn into my school preventing me from participating for 3 weeks. Doctor said if I wasn't wearing glasses and took that full force it would have shattered my eye socket and if not killing me by hitting my temple. I read that as your leg fell off. Took me another read to figure it out. Urologist here, not native speaker. So a girl who is 14 years old gets delivered to us with urosepsis. We get it under control and she recovers. No biggie. But later she came always back with acute urinary tract infections. At that age it's pretty rare. So we done a cystoscopy. It's like an examination where we push a camera through the urethra to the bladder to look what's going there. And the bladder had a few birthday candles inside. You know the small thin birthday candles? Don't know if you have it in USA. So this girl caused herself a lot of acute infections because she apparently had the hobby to push birthday candles in her urethra. Your English is good enough for me to understand what happened, which is unfortunate. Pretty sure my urethra screamed when I read that. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.